Lung cancer is the second most common cancer for men and women here in the United States. That's according to the American Cancer Society. Health professionals say early detection for lung cancer makes all of the difference when it comes to survival. Thanks to the state-of-the-art robotic technology, doctors at USA Health can detect lung cancer earlier and more precisely. NBC 15's Karis Harmon joins us now. Karis, you got a first-hand look at those robotic procedures work today.
Yeah, I did, Kim, and they've completed more than 400 of those procedures, which they call a game changer in treatment for lung cancer.
Lung cancer claims as many lives each year as breast, colon, and prostate cancers combined, according to USA Health.
Lung cancer is very hard to diagnose because the symptoms don't usually come on early in the disease. So when you're talking about stage 1 or stage 2 disease, patients are walking around and they don't realize that they have, cancer.
If caught early, the lung cancer survival rate jumps up to more than 60%. That's where Monarch's robotic assisted technology comes in.
It allows us to be much more accurate in the lung itself. So the traditional bronchoscope is a handheld scope, and it really only allows us to see and work in the middle part of the lung where the main airways are. Anything out to the edges, traditionally, we just were blindly going after. So you can imagine being blind, the results weren't great.
This is how it works. The doctors insert a scope into a patient's throat using this, a gaming controller. From there, the scope allows doctors to see inside of the lungs and what cancer lesions could be lurking. Then the robot collects a small piece of lung tissue, analyzing it within minutes.
With the result being going from a 40 to 50% miss rate with a traditional bronchoscopy to 10% or less in these cases. So it's much, much more accurate.
He says with the traditional bronchoscopy, if results come back inconclusive, it wasn't uncommon for patients to get secondary procedures just for a diagnosis.
So that tells us the traditional easy technology, so to speak, was not working for us.
It's definitely the standard of care in bronchoscopy at this point. So definitely a game changer.
The Mithcell Cancer Institute is the only standalone bronchoscopy lab in the United States performing robotic procedures. And they're teaching other doctors how to use it.
As new physicians come on to utilize Monarch, it's best to get them trained by physicians that are using Monarch. And so this is one of our sites, nationally that we do that in.
Since Monarch's launch at USA in 2019, doctors there have achieved a more than 15% improvement in overall lung cancer detection. Kim?